Hey everyone, my name is Anastasia Young and I'm the pelvic floor therapist here at the Center for Spine Care and Mobility in the Flatiron District of Manhattan. And today I want to talk to you a little bit about this article that I read about the COVID-19 implications on the pelvic floor. I think this was a really fascinating article and I provided a summary of it in the blog above, but I wanted to talk a little bit about some of the symptoms that we tend to see as pelvic floor therapists, how they're impacting our lifestyles and what COVID could actually do to our system. So a lot of what goes on in the pelvic floor, which is down below, it really works well with the diaphragm to create breath and to create movement and stability and things like that, kind of like in this piston sense. So when you see me talk about piston, that's kind of what we're talking about. When the pelvic floor is descending, the diaphragm's descending, when the diaphragm comes back to a regular position, the pelvic floor is going to gently contract. It helps with airflow. Your core works together as well to get all of that air out of your lungs. But the difference is that when we have dysfunction of pelvic floor, sometimes the diaphragm's descending, this isn't moving. Sometimes this is too tight, it's stuck up, this is trying to descend into it. Sometimes the core around isn't working properly. And we could end up with symptoms like incontinence, and we can end up with constipation and pelvic organ prolapse and things like that. So when you have COVID, as we've been seeing with a bunch of these patients, what are the main symptoms that we all kind of know about is that chronic kind of coughing, that cough that doesn't really rid anything out of your system. It's that dry cough, difficulty breathing, things like that. So if we're having coughing where we're putting more pressure into the pelvic floor and more pressure into the abdomen constantly, and trying to, get the air out, when they're not working together, we have dysfunction there, right? And if we have difficulty breathing, same thing, the diaphragm isn't descending properly and allowing air to come into the lungs in kind of this negative airflow sense. Guess what? Pelvic floor has to work with that. And when that doesn't work properly together, we could end up with pelvic floor dysfunction. So someone that may be completely, healthy, asymptomatic, we'll say, not necessarily like healthy, not healthy. I don't like using those terms really. But someone that may be asymptomatic can end up with symptoms after coughing too much, after not being able to breathe properly, things like that. So we want to make sure that we assess and treat all these symptoms as we need.